Hi, Anindita. It is so nice for you to join me.
Thank you for inviting me.
No problem. This is great. But for anybody listening, would you like to introduce yourself?
So, hi everyone. I'm Anindita. I'm an assistant professor in Azim Premji University, where I'm actively working in the area of mental health. So, I'm a licensed clinical psychologist. I'm registered with the Rehabilitation Council of India. I've done my PhD in clinical psychology from NIMHANS in Bangalore. I've been interested in this area for a pretty long time, almost like 10 to 12 years now. So, I like to juggle both academics and clinical work.
The very art of juggling. I don't think I know how to do that yet. You did say that you work as a clinical psychologist. What would the perspective a clinical psychologist can offer when you try to understand mental health?
So, clinical psychology is basically looking at evidence based practices of what would work therapeutically for a person who has been diagnosed with a clinical disorder. And there are very clear cut criteria of what will define something as a clinical disorder.
Right.
So, individuals who fall under that sort of experience extreme amount of distress where it affects their personal functioning. They come to a clinical psychologist, and clinical psychologists usually offer various kinds of psychotherapeutic techniques, then helping the client sort of work through a series of issues in a very structured and logical way.
So, in that case, given that BFRBs are classified under the DSM-5, how would you start talking about it? What are BFRBs?
Right. So, quite possible, that all of us knew at least one person with a BFRB, which is body focused repetitive behavior, because it's extremely common. It happens to almost 2 to 5% of the population.
That's about 1 in 20 people.
That's about 1 in 20 people. Yeah, exactly. It's described as a general term, which is for any kind of repetitive self-grooming behavior,
Right.
which could be pulling, picking, biting, scraping of the hair, skin or nail. And this causes significant distress to the person and can also cause damage to the body.
How then would you explain why this comes about to that many people?
Right. So it's been found that a lot of people with BFRB actually have a genetic predisposition towards it.
Right.
So it's very common to find people who have another relative or a very close family member who sort of is suffering from a similar disorder. But it's also important to remember that even if you have a predisposition, it's quite possible that there are other factors which are environmental in nature, which could be temperamental, which could be something to do with the environment, to do with the age of onset, to do with family stress factors, which sort of impact an individual. So everything comes together, the genetic predisposition combined with the environment, which makes a person sort of be more vulnerable to this kind of a disorder.
Right. So if you look at the DSM-5, they've classified it under something called obsessive compulsive related disorder.
Right.
Drawing with that, I wanted to know how and if it is different from OCD or obsessive compulsive disorder.
Though it is sort of placed under that bracket, it's different from OCD in the sense the person who is experiencing symptoms of OCD like compulsions and obsessions, you will see that many of them sort of get extremely distressed by it, and they feel that their compulsions are a result of the obsessions which they are facing.
Okay.
But in BFRBs, what really happens is people who do it may do it in response to relieving stress. It could be a particular kind of habit which sort of helps them feel better. So it could be part of self-soothing behavior as well. Also, it has been seen in neuroscience research that OCD and BFRB are very different when it comes to the brain regions which are involved in certain kinds of behavior, which is to stop a habit. Though they are sort of clubbed together, they are quite significantly different.
But I think something that you did bring about was this notion of a habit, which is very commonly associated with BFRBs. I would like to know then, how would you distinguish a BFRB with something like just a bad habit, which is something that's often thrown into a conversation when you talk about BFRBs?
So it's unfortunate that, many people who have BFRB are sort of accused, saying it's their problem, they have sort of caused it because they just can't stop this particular bad habit. But interestingly, I mean, BFRBs are very, very different from habits in the sense that though they are repetitive, it's been seen that BFRBs cause significant amount of personal distress, and they
Right.
hamper your social, occupational, and personal functioning. And people who have BFRBs, they try a lot to stop this behavior. It's not like they're not trying to.
Yeah.
So unlike a habit which you can stop when you want to, people with BFRB have repeatedly tried to stop from pulling or picking, but they're just not able to do it, right? And it
Right.
causes significant amount of personal distress as well. So it will be wrong to say that it's something which is intentional, which these people can stop when they want to.
Right. I think this was really informative and really insightful to actually have you break this down for me. But I think I am very privileged enough to have sat in your course, and I think a lot of this makes sense to me. But I would think it's harder, especially given that the onset of this is for children, it can start at the age of 8. It can start as young as that. And given that it's not something that's commonly heard, you the sort of research that a lot of people do would be to go on Google and quickly type in something and to understand it. But you're hit with jargon, you're hit with a lot of words that don't make sense, right? So I think something I would really like you to do, and something I was hoping would be a theme in this entire series, would be how would you explain it to a child who's just learning about this behavior for themselves?
That's a really nice and interesting question. Let me see, let me try. So if I have to explain it to a child, tell them that, if they're engaging in any behavior which feels a bit too much and they're not really having fun, they're losing interest in other things around them, but they're
Yeah.
repeatedly doing something because there is a very strong urge, maybe that's when they should talk about it to an elder.
Right. Taking up with what you said about seeking help, would you like to elaborate on a bit of what kind of treatments are available?
If you look at psychotherapy, there are different kind of approaches which have been found to be very, very effective. Cognitive behavior therapy, for people who are not too aware about that therapeutic model, is focused on identifying thoughts, feelings, and behaviors that are problematic, and which teaches individuals to challenge some of their rational thoughts which they have, which can lead to stress. So, under the umbrella of CBT, there are a lot of different techniques which have been now sort of they have been designed now specifically to treat BFRBs. So, one is habit reversal training. So, habit reversal usually is it has three different components from what I remember. One is having an awareness training where you become aware about what is happening to you, what is leading to the sensations, what are the triggers, which could be internal, which could be external, which make somebody pick or pull. Then there are competing responses which are being taught to that person. So a simple example is, if I feel the urge to pull my hair, a competing response like folding my hands or locking them
Right.
is taught. Or if the texture is something which sort of makes me get the urge to pull my hair, can I hold something else, something cold, something which is soothing, which is like a competing response to it? And social support. So, how can the caregiver sort of support somebody? There are also other treatments which are similar in nature. One is comprehensive behavioral treatment model, which is specifically used for BFRB. It has been found to be very effective. Another one which I would like to talk about a little bit is acceptance and commitment therapy, which has been found to be very, very useful because it sort of, it sort of adds to other cognitive therapies because it focuses on how do you accept the urge to pick or pull, and rather than sort of trying to distract yourself, trying to look at a competing response, how do you experience the negative emotions and you accept it and you sort of try to deal with it. So understanding the feeling and experiencing that one does not have to respond to an urge or emotion every time is something which is being taught by ACT. So some of these techniques have been found to be extremely effective. in general.
So, what is the stance on medication? So, something that I was prescribed during my first diagnosis was SSRIs, or selective serotonin reuptake inhibitors. So, I was given that. And I think something that they also look at in general is what's medication that's prescribed with anxiety or depression. I guess because there's also a very likelihood that in some cases you can have a conjunction of these illnesses, and one can maybe feed into another. But I think they aren't always helpful. So, what is medication, I guess, that we know that works for BFRBs?
I think it's exactly what you said, that, some of the medication has been found to be effective for some people, but we don't really have foolproof medication for BFRBs yet. Most of the research studies have shown that just medication have not been found to be very effective.
Right.
And most of the time, it needs to be in conjunction with other psychotherapeutic approaches. Yeah, unfortunately, we don't really have a very clear sense of, what kind of medication will help. But I think that's the thing. The BFRBs, some of the psychotherapeutic treatments have been found to be extremely effective. And if people approach professionals when they see that they're sort of going through extreme distress, I think they can find a way out. They don't really have to suffer alone.
Absolutely. Like we said, it's 1 in 20 people. That's an estimate. But again, that is an estimate that we know from research done in the United States, which I think brings me to a big question around not just maybe BFRBs, but specifically BFRBs, and also mental health research in India itself. So you're someone who's worked in this field for long. You've done your PhD around these things, but I think something that I would like you to maybe talk about a bit is how does research around this first impact the knowledge base that you need to like handle and tackle these things, but also um, another question I wanted to follow up with is what do you think might be um, some some sort of barrier to having actual proper information, because we don't seem to have numbers about BFRBs in India yet. So how do you think about that?
I think there are various reasons for not having like enough research base to comment on the numbers. First of all, there's a lot of stigma attached to approaching mental health professionals. Yeah. So people who have BFRBs, many of them choose to suffer alone in isolation and not really approach a mental health professional. Right. I think first and foremost, it's important to spread awareness about this disorder, and I think exactly what you're doing right now, right? Having a series of conversations around this, so that people are aware of it and they don't feel ashamed. They don't feel like they're different, that this doesn't happen to other people. Yeah. So I think first and foremost, it's important for us to talk about it more openly, sort of accept that this is a real problem. It's not something which makes somebody weird, because a lot of people get bullied because of this.
Yeah.
So there's a constant feeling of shame, isolation, and we need to break that and say that like many people engage in this, many people suffer from this, and there is treatment available. One has to start talking about this to eventually feel better. Right? So the first thing, in my opinion, is to break the stigma around BFRBs, to talk more about it, teach parents, caregivers on how to spot BFRBs, how to help people with BFRBs, and talk more openly about it.
Yeah. So how would you suggest friends and family or like support groups that are around, how do you ask them to help out? What could they possibly do?
I think as a family member of someone with BFRB, what becomes important is to be well informed. So friends could be well-meaning. Family members often wish to be helpful, but at times in their well-intentioned effort, They can also say certain things which could be hurtful and may even contribute to, to the problem sometimes.
Yeah.
So I feel the most important thing for a family member would be to maintain a supportive role, make sure that they communicate effectively directly to the person and tell them why are they concerned about the person, what's happening, what are they observing, because many times, like you rightly pointed out, that it happens to children. Trichotillomania is typically what happens around the age of, which starts at around the age of 11, 12 years.
Yeah.
Skin picking may come a little later, but it's important to tell children that it's what they are facing is something which can be dealt with in a very, very sensitive manner. Also, it's important for caregivers to, look at how to build effective channels of communication with that person. They need to be patient. They need to be flexible. They need to look out for resources. Some of the resources are available on BFRBs, which give a very, very good idea about what to do, when to seek help.
Yeah.
So, looking at some of those resources is extremely important. Another thing which I've noticed, like I have dealt with a few instances, where um, a parent has brought in a person with BFRB, and what I've noticed is that the parent themselves look extremely distressed. So
Right.
for a caregiver to have a person in the family, suffering from something like BFRB is not easy, right?
Yeah.
It's extremely difficult to see a loved one who is suffering. It's extremely important for that caregiver to, take care of themselves as they try to support and assist their family member as well. What I would suggest is, I mean, there are a lot of books available. There are other resources available to family members who need support. I'm not sure in Indian context, a support group is still, I don't think there are many support groups. So I think it becomes important that those parents to maybe come together and form a support group, right, where they can talk
Right.
about some of these issues clearly. Many people choose to suffer alone because there's a lot of shame, guilt associated with this. So it's difficult to get the real numbers because of the stigma attached to it.
Right.
Um, that may, of course, be because of a lack of awareness, because we don't really talk about it in as much detail. In the Indian context, we hardly talk about other mental illnesses, right? So, the research around mental health in general is at a nascent stage. There are not many studies. Like there are some um, particular areas which are quite well researched, but there are many other disorders which are not as well researched. And with BFRBs, where there's so much shame and isolation associated with it, people hardly want to talk about it.
Yeah. Thank you so much, Anandita. It was amazing to have you talk to us.
Thank you, Swarna, and I'm so glad you're doing it on a topic like this.
Thank you.
Um, Thank you so much for inviting me.
This is my pleasure. All right. I will see you soon.
Okay. See you soon, Swarna.